Good afternoon, everybody, and welcome to this PPE Facebook question and answer session, also being broadcast via Zoom as well. So welcome to all colleagues who've joined us this afternoon. My name's Liam Brennan. I'm Deputy Medical Director and Consultant Anaesthetist here at CUH. And as you know, we did several PPE Facebook sessions back in the first wave to give you an update on where we were with the PPE situation. And we haven't done one during the second wave, but we thought this was a timely opportunity to do so. So I'm joined this afternoon by my colleagues, Christine Moody, known to many of you as our clinical nurse specialist in infection control leading on COVID. Jamie Whitehorn, Dr. Jamie Whitehorn, who is a consultant in infectious diseases and microbiology here at CUH, and also by Carol Young, the lead clinical nurse specialist in tissue viability, who's going to talk about skincare issues. So what we're going to do for you now is we're going to go through a very short PowerPoint for no more than 10 minutes, just to give you some of the main points that we wanted to highlight to you this afternoon, and then give you an opportunity to take your questions. So really just to start off with the first slide, please, Tony. The first thing I wanted to emphasise is that the supplies of PPE in the organisation are secure and robust. You'll remember the real concerns that we had during the first wave, particularly in the really difficult months of March and April, when PPE supplies were precarious at times, and we are in a much, much better situation now in the second wave. During the summer, the national team put together a national supply strategy for PPE that seems to be working well. And in particular, more than 75% of all PPE that we are now using is UK sourced. So we no longer are as dependent on overseas procurement as we were. You can see from the slide here, and this is the daily update we get from our own procurement team, we have adequate supplies of all PPE categories across all lines. They're all in the green zone, meaning there are at least more than 12 days supply of all items currently within the organisation. We have a better range of FFP3 masks, which I know have been a concern for colleagues, but to reassure you, we have FFP3 masks to suit all facial types now. And the supplies we get from the national procurement team are also supplemented by our own independent sourcing of PPE from our own fantastic procurement team that we have here at CUH. In particular, with supplies of the reusable JSP type respirator masks that many of you are using, and respiratory hoods. And this whole strategy that we have for PPE in the organisation continues to be led by an executive team-led task force, which meets twice weekly to troubleshoot, identify problems at an early stage to make sure we have continuity of supply for PPE to keep everybody safe across the organisation. So I'm going to hand over now to Jamie Whitehorn to take you through the next two slides.
Thank you. So just a couple of things I want to highlight in these slides are the changes from the first wave. And the first thing to mention is that we are now encouraging patients to wear face masks as much as possible. And this should be particularly when patients move around, but it should also include when they're in their bed or sitting at their bed space. This policy applies regardless of their COVID infection status. So it's relevant in green wards as well as amber and red. There are a few exceptions. So we don't recommend this in children, women in labour, patients who are receiving oxygen therapy, or patients who are confused, delirious, or intolerant of masks. Could I have the next slide, please? The other change that we've made is that we're advocating the use of FFP3 masks in all red areas, regardless of whether AGPs are being carried out or not. This change in policy was prompted by an increased recognition of numbers of staff becoming positive in red, who are working in red areas. This has been supported by a local risk assessment and also our regional NHS England team. It's worth noting that the PHE still recommend fluid-resistant surgical masks as an appropriate level of PPE for red areas where AGPs are not occurring. And they also recommend that level of PPE for amber areas. We're keeping that under close review for our local practice at CUH. Because of this, it means that all staff who work in red areas must ensure that they're fit tested. And this can be done by emailing the email address on the slide to arrange an appointment. I'm going to pass you on to Christine Moody, who will take you through the next slide.
Okay, so really just a summary of the fact of what Jamie's just said. But we recognised as a team that some of our posters and our videos that are certainly up on the staff portal are not reflective of the changes that we've made. And obviously the increasing incidence of the virus since the summer months obviously have also precedented this change. So there will be some changes to the staff portal. The new posters are already up there in a PDF form, so they can be printed off if you needed one urgently. The videos that we originally did in the first wave have been taken down, but what is still there is the fit checking videos, which still stand for both the valved and non-valved masks that we currently do use within the trust. So if I take you to the original poster, scenario 0, which we are currently going to be using in our outpatient areas. And as it says there, if there is a need for additional eyewear, then of course this can be used. And what we would hope is, and we know that majority of patients that come into the trust do have a mask on. So the fact that the patient has the mask and you have the mask, and there's a 98% efficacy rate with these masks, that there should be a limited spread between a patient and a staff member. Clearly, patients are assessed on admission to the hospital within the clinical area. Questions are asked, and if it was felt that a visor was required, then these should be worn. Next slide, please. So scenario 0 plus is what you will be seeing in all your green areas, and really we have gone with placing a visor since early autumn with our staff, and this is just because we have seen transference over the last few months where patients have been brewing COVID and have started to cough, and there is that potential then for the COVID to get into the eye area, but your mask does its job by covering the respiratory system. As it says on there, for your non-AGPs, this is the key point for your scenario plus PPE. If you are doing an AGP, this is where we have gone to a scenario 0 plus. Sorry, scenario 1 plus. Too many scenario zeros with pluses. Next slide, please. So scenario 1 is now what we would be wearing in our amber areas or any wards that are close to admissions. So the real difference between this and scenario 0 plus is the fact that you have the scrubs. So you may find that if you have a couple of bays closed on an area, that your staff will need to go into scrubs, and scrubs will be made available for staff to be able to use this. If I can go to scenario 1 plus, please. Okay, so on the red wards, the main difference here from what we were doing before was the use of the FFP3 mask. This would also be used in your areas where you have, on a green ward, where you have AGPs being performed as well. So wards such as A4 and A5, which have green trachea bays, and over in M5 generally, or in N3 where there is high flow nasal oxygen, CPAP or NIPI. So these are the areas where you might see this scenario being used on what we consider a green ward. But the biggest change for us from the 22nd of December is that we've gone to the FFP3 mask in our red areas. Next slide, please. Next slide. Scenario 2. So this really pertains to majority of your intensive care areas. And as you can see, this is where we have a gown. So by using the gown, you can note this is quite different from what we did before, is that we're asking you to roll the sleeves up of the gown rather than have them down and using double gloves. The reason why we've made this change is that we noticed that we were seeing increased infections in certain areas, bacterial infections for once, not viruses, but we are asking people to roll up their gown and do a very good hand wash in between your patient care. So you'd wash your hands or gel your hands before you put your gloves on, put your apron on. You should apron first, then your gloves, in that order. Do your patient care and then remove your gloves and change your apron between each individual patient. Next scenario, please. So the only one that's really very similar to what we were doing first time round is your scenario 3. And this is really about doing your aseptic procedures. So places like theatres or maybe in your vascular access unit where you need a long sleeve sterile gown and your apron and gloves on top. Okay, I'll hand you back to Jamie.
Okay, thank you, Chris.
Thank you so much. Thank you. So this slide is just really emphasising the importance of taking a lot of care with donning and doffing to minimise the risk of infection. And the posters are up in the relevant clinical areas, and they're also available on the staff portal. And it's worth just taking time to do this thing properly to minimise the risk of infection, to protect yourself and also your patients as well. I'm going to pass you on to Carol next.
Thank you.
Carol, thank you.
Thank you. So I'm just here, we've had quite a few staff inquiries over the past couple of weeks about skin condition under the use of masks. So we just wanted to really reiterate the guidance that we put into place during the first surge and is available for you still. We did a lot of work with occupational health and dermatology to produce these guides and also to produce a referral pathway for you. Most important thing is that we try and make sure that we prevent skin breakdown, and that's by maintaining good skin health in the first place. Good hydration, drinking fluids regularly throughout your shift, making sure you maintain a good skin cleansing and moisturizing routine before and after work. Now, you might find that you need to change the cleanser that you normally use because when your face is occluded under a mask, it's producing more oil. So you may find that you're getting a few more spots, a little bit more greasiness, sweating, and debris on your face. So you need to change your cleanser slightly. We ask that you don't use thick moisturizers. We've heard stories of nappy creams being used on faces. Please don't. These affect the fit of your mask, but can also affect the condition of the rubber seal on your mask as well. What we do suggest is that you can use the Cavalon barrier film to protect your skin over the areas of your noses, cheeks and chin. Make sure it's fully dry before you don, because otherwise it's a bit tacky and will stick to your mask. And you can find Cavalon on all clinical areas or order from procurement. Do report any skin damage via QSIS. This means that we can monitor how many people are being affected, but also if there's a specific theme that we need to be looking out for. Self-refer to occupational health, who will triage you, and they'll either refer you to tissue viability or dermatology for you to get the specialist advice that you need. If you've seen us, we might recommend a thin dressing such as Duoderm Spot to go over broken areas. Please only use this and not any other dressings, and only if you've had advice from us. If you're wearing a dressing, you must have a refit test with your dressing in place, because it's a chance that your mask may not seal, and you may be advised to wear a hood or work in a different area. On a rare occasion, we may say that you shouldn't be at work until your skin has healed. So please speak to your manager, infection control and occupational health for further advice, and also see the skincare policy and guideline on Connect.
Thank you, Carol. So to summarise, I just again to reassure you that the supplies of all lines of PPE are currently secure for the organisation. We're encouraging you, all of us, to encourage our patients to wear fluid-resistant surgical masks as much as possible to mitigate the risk of transmission of the virus. We have introduced the use of FFP3 masks in red areas, so make sure that if your staff working in red areas that you've been fit tested. The PPE scenarios, if you've seen from Chris, have been refreshed to reflect the local incidence of the virus, local expert advice, and also in conjunction with reviewing the national infection control advice as well, guidance. On top of the PPE scenarios, it's really important that you pay strict attention to correct donning and doffing practice. It's really, really important to make sure you minimise the risk of cross-infection of the virus when you are taking on and removing PPE. And of course, we will continue to review the guidance on PPE on a regular basis, taking into account local advice and also that from the national team. So that's the short presentation from us. We're really happy to take any questions that you may have. While Tony is just getting those together, we had a couple that were received already that came in via email. The first question was from a colleague saying around facial hair, saying that I was turned away from mask fit testing as I was told my facial hair was too long. I clean shaved the night before at 11 o'clock. What is the expectation of male staff members working on red wards in regard to their facial hair, and are they expected to clean shave every morning prior to working on a red ward? Chris, do you want to take that one?
Yeah. Yes, thank you, Liam. So obviously this is really an individual thing, and it may be that staff will have to shave more frequently depending on their individual facial growth. But clearly, if you do have longer facial hair, it does affect the seal when you put your mask on. So therefore, you know, being clean shaven, doing your fit check is everything that we ask so you to be safe working on the red ward.
Thanks for that, Chris. And then the second question that we received was an email thanking us for introducing the use of FFP3s into the red areas, and asked if we had any plans to do the same for amber wards. I think we've alluded to that in the comments Jamie made in the PowerPoint. We're aware of those concerns being expressed by some staff members. We are keeping that situation on those amber wards under close surveillance. Our occupational health team are keeping an eye on staff positive rates, not only in the red ward areas, but also in the amber and amber wards, not just the amber wards, but also ED and N2 as well, where those staff members are already wearing FFP3 masks. So we are keeping that situation under close surveillance, and we will make any changes or recommend any changes to policy in conjunction with local experts and in discussion with the regional NHS IE team. So, Tony, anything else that you'd like to take us from now? Any questions from Facebook or from Zoom?
I don't think we've had anything through Facebook or Zoom just yet. We could give people a minute just in case they're typing. I think the also, if people do have questions, we'll make this recording available on the portal. So if there are supplementary questions afterwards, we'll make sure we come back to those separately as well. We can pick them up afterwards.
So while we're just doing that, so Christine, the posters that you've taken us through, those have been distributed in the past couple of days to clinical areas, haven't they?
Yes, and if we have run out, because it's always very hard to estimate numbers completely, we have ordered some more, and it just takes a few days for them to be printed and come through, so we will make sure that you all have everything that you require. But I know the team have been walking and giving out posters to all the areas.
And along with the posters that you've shown us, which is the headline poster, if you like, there are also donning and doffing posters appropriate to each of the scenarios as well, that go alongside them for those areas as well, aren't there?
There are.
Okay. Anything for us, Tony?
No, nothing coming through.
Okay. Carol, can I just ask you, is there around tissue skin issues, are we seeing as many of those in the second wave as we had in the first, or do you think we've learned from the first wave about how to manage this situation better?
So I think that at the beginning of the first wave, we had a bit of a flurry, and a lot of it was very anxiety driven, and staff noticing the smaller red areas very early. I think the guidance has certainly helped. We saw a big settling down from July onwards. We had no reports of pressure damage. and a reduction, much bigger reduction of damage and skin acne and spots and things. And we've had nothing really up until December. And then that's really just, I think, as the red wards have increased and the changes in December to that more FFP mask wearing, we have seen that quite a big increase again. And I would say I've probably had a few more calls this time. Certainly in the last week, I've had about 8 to 10 staff contacting me, either via the staff Facebook group questions or contacting me directly through email or through the occupational health referral system. So what's really important is that we get that monitored so we can measure the numbers. So that's where the QSIS forms are really helpful, because that way we can pull that data over a course of time and we can start to see if there's patterns. And I think certainly that change with the masks in December has had an impact in seeing more skin damage. But staff are getting much more aware and picking it up earlier, I would say.
Thank you very much, Carol. Tony?
No, nothing coming through.
Okay. We'll give it another couple of minutes. I think maybe the other thing I just wanted to again emphasize with people online is the real importance of fit testing. We have fit testing available every day in the organisation, and with multiple machines available and fit testers available in several locations across the organisation. Please email the address that was given on one of the slides. It is also available on Connect and on the staff portal if you've not made a note of it. But this presentation will also be made available to you. To get your fit testing booked in. We really can't emphasize enough the importance of making sure that you keep yourself safe when you go to red areas, and make sure you've got the right PPE available, the right RP, respiratory protective equipment available, in terms of either a disposable mask, a reusable mask, or one of the respiratory hoods. We have a good supply of respiratory hoods, which is the alternative if you can't successfully fit test, to either a disposable or a reusable mask available across the organisation. So we have got the right RP to keep everybody safe going into red areas. So please do not hesitate to get yourself fit tested. We really want to make sure everybody is as safe as possible. Chris, did you want to make a comment?
Yeah, I really just about the hoods. So there are training videos for the hoods, and clearly our team do support doing some training for this. So Trish Brindley is our main hood trainer, and key areas theatre certainly have got quite a few. But I think just to be really safe and sure, if you're unsure about the hood that you're about to put on and you're not 100% sure that it's got all the parts, then please do not use it. Discuss with the nurse in charge, because there are enough hoods around the trust that you will be able to get another one. And like I said, there is always the training video just to refresh yourself if you're unsure.
And where's that training video?
That's on the that is on the PPE portal.
That is on the portal.
Yeah, it is.
Thank you very much for that. Okay, Tony, anything?
We've just had a question through Facebook. Are you getting good compliance with PPE audits for reusable hoods?
Audits for reusable hoods. Chris, have you got any comment on that about audits? Is this specifically about hoods? Was it? Tony?
It does say, yeah, it does say kind of reusable / hoods.
Okay.
So general compliance, I think, in audits.
So we do PPE audits, and that will very much encompass the JSP and the 3M masks that are reusable. Hoods we are also looking at, and we haven't done as many audits of that, but that's certainly something that is we are doing as we speak now. And I think what was really interesting is to see the compliance also in the red areas. I think we know the areas that have been wearing the FFP for a long time, such as your ITU areas, your theatres, the compliance is very good. The use of doing the fit checking is very good. But we just need to feel reassured that since we've made the change, that staff are doing what they should be in the red areas appropriately.
Thanks, Chris. Very helpful. Anything else, Tony? Okay.
No.
All right. Well, look, I'm going to draw the session to a close. Can I thank everybody online for tuning in and listening? This has been recorded and will be available through the staff portal if you want to look at the presentation again and hear any of the responses from the panel to the questions that we've had. Just remains me to say thank you to everybody. Thank you to my fellow panel members for joining me this afternoon for this session, and to Tony Brand in comms for coordinating it. And thank you again to all of you online, and please stay safe and have a good weekend, everybody. Thank you. Bye-bye for now.